1. Which of the following best supports adult learners in a CGRN review course? A. Passive lecture format. B. Interactive case discussions. C. Memorization drills. D. Repetition without feedback. 2. A nurse educator evaluating a CGRN exam prep program should focus primarily on A. Student satisfaction surveys. B. Learning outcomes and knowledge retention. C. Length of each session. D. Amount of reading material provided. 3. In curriculum development for CGRN candidates, which principle is most essential? A. Aligning content with test blueprint. B. Designing sessions based on educator preference. C. Limiting materials to a single source. D. Using only visual media. 4. Which communication method is most effective for mentoring a CGRN candidate? A. Providing corrective feedback with specific examples. B. Giving only positive reinforcement. C. Avoiding discussion of errors. D. Using only written notes. 5. Which regulatory compliance factor is critical when preparing nurses for CGRN certification? A. Ensuring HIPAA principles are integrated into scenarios. Avoiding mention of any federal guidelines. C. Teaching only facility-specific rules. D. Using outdated regulatory references. 6. During evaluation of a CGRN practice session, the educator should prioritize A. Learner engagement and demonstration of critical thinking. B. How quickly the session ended. C. Number of slides presented. D. Attendance count. 7. A key element in adult learning is A. Relevance of content to professional practice. B. Lengthy theoretical lectures. C. Ignoring prior experience. D. One-way communication. 8. Which tool best measures effectiveness of CGRN test preparation? A. Pre- and post-test comparisons. B. Seat comfort surveys. C. Attendance records. D. Length of study guide. 9. In mentoring a new GI nurse, the most effective strategy is A. Encouraging reflection and self-assessment. B. Directing without explanation. C. Limiting exposure to clinical practice. Avoiding feedback. 10. When designing a CGRN curriculum, it is important to A. Map objectives to certification exam domains. B. Focus only on advanced pharmacology. C. Avoid integrating patient safety principles. D. Use a single delivery method. 11. Which evaluation method ensures validity in CGRN prep? A. Multiple choice test aligned to competencies. B. Open discussion with no structure. C. Attendance tracking. D. Informal chatting. 12. Adult learners in CGRN preparation benefit most when A. They see immediate application of knowledge. B. They memorize without context. C. They avoid active participation. They receive no feedback. 13. Which communication style enhances peer learning among CGRN candidates? A. Open-ended questioning. B. Authoritarian lecturing. C. One-word answers. D. Silence during feedback. 14. Regulatory standards most relevant to gastroenterology nursing education include A. Joint Commission guidelines. B. Outdated nursing manuals. C. Non-health-related legislation. D. Personal preference rules. 15. When creating assessments for CGRN readiness, the educator should ensure. A. Questions reflect clinical scenarios. B. Only recall is tested. C. All questions are identical. D. No feedback is provided. 16. A mentoring technique that builds critical thinking in CGRN candidates is A. Socratic questioning. B. Memorization drills. C. Silent observation only. D. Copying notes. 17. Which principle ensures inclusivity in CGRN educational programs? A. Adapting teaching to different learning styles. E. Expecting uniform pace for all. C. Using a single teaching method. D. Ignoring cultural differences. 18. During evaluation of CGRN course outcomes, the educator should A. Compare learner performance to benchmarks. B. Focus only on course length. C. Disregard learner feedback. D. Measure attendance only. 19. Which communication approach supports effective feedback? A. Timely, specific, constructive feedback. B. Delayed feedback after several weeks. C. Vague generalizations. D. Ignoring learner concerns. 20. Curriculum development for CGRN should be based on A. Evidence-based practice and exam content outlines. B. Random topic selection. C. Educator preference alone. D. Learner entertainment. 21. Which regulatory compliance must be reinforced in GI nursing practice? A. Infection control standards. B. Outdated documentation policies. C. Non-medical workplace rules. D. Irrelevant codes. 22. A principle of adult learning especially relevant to CGRN candidates is A. Respecting prior professional experience. B. Dismissing learner backgrounds. C. Ignoring clinical practice examples. D. Delivering identical sessions. 23. A post-test analysis in CGRN exam prep should determine A. Areas needing reinforcement. B. Which students missed class. C. Who liked the slides. D. Which room was used. 24. In mentoring, role modeling is effective because A. It demonstrates professional behavior in practice. B. It avoids engagement. C. It discourages questions. D. It limits communication. 25. Effective communication during CGRN review involves A. Active listening and clarification. B. Ignoring learner responses. C. Monotone reading. D. Using only technical jargon. 26. Which evaluation method best measures skill competency in endoscopy care? A. Direct observation with performance checklist. B. Counting study hours. C. Reviewing written notes only. D. Tracking seat assignments. 27. Curriculum mapping ensures A. Alignment of teaching activities with learning objectives. B. Duplication of random content. C. Omission of assessment. D. Disorganized teaching flow. 28. Which mentoring approach fosters autonomy? A. Guided decision-making practice. B. Dictating all actions. C. Limiting learner independence. D. Ignoring learner input. 29. Adult learners in CGRN prep need A. Problem-solving opportunities tied to clinical work. B. Memorization without context. C. Isolation from practice. D. One-way instruction. 30. Regulatory compliance in sedation practices emphasizes following credentialing requirements. B. Ignoring national standards. C. Using outdated techniques. D. Skipping documentation. 31. An effective evaluation strategy for CGRN readiness is A. Objective Structured Clinical Examination, OSCE. B. Measuring note-taking speed. C. Counting class breaks. D. Collecting sign-in sheets. 32. In curriculum development, Bloom's taxonomy supports A. Structuring objectives from knowledge to evaluation. E. Random question writing. C. Avoiding higher-level thinking. D. Using only recall. 33. Mentorship and CGRN prep is strengthened by A. Establishing trust and mutual respect. B. Discouraging questions. C. Limiting dialogue. D. Rigid instruction only. 34. Effective communication during simulation requires A. Clear debriefing and reflection. B. Silence from the instructor. C. Avoidance of questions. D. Repetition only. 35. Evaluation of learner outcomes must consider A. Knowledge, skills, and attitudes. B. Only attendance. C. Classroom temperature. D. Number of slides.